Hi, I'm Steve, back here for our Tuesday interview with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center, you can find them online, um, and they're in Reno, Nevada. So welcome, Doctor.
Hi, Steve. Thank you for the invite again.
So I know, I've known you for a while now. You go to this Las Vegas seminar and kind of learn about a lot of the new anti-aging new methods and treatments and so on, which I know that you enjoy a lot because you always come back with new stuff. So let's talk about something new, Naltrexone. Um, what is it?
Yes, Steve. So I thank you for noticing the new things also that we come up with in relation to the therapies that we offer here in the clinic. And again, fresh off the presses. So recently, the concluded Anti-Aging World Congress that I attended last weekend had actually produced or introduced to us newer forms of therapies. I mean, this is not new, it's out there, but it's now being used clinically more than ever. So when you mentioned about naltrexone, this is one of the hotter topics when I was there. And as we provide our viewers with the cutting edge knowledge and information, let me deliver to you what is going on in the anti-aging world right now. So naltrexone belongs to a class of drugs known as opiate antagonists or blockers, and it works on the brain to prevent reverse opiate effects. So when I talk about opiate, we're talking about Percocet, Lortab, morphine. So we hear about this a lot with pain problems. And when you actually use these medicines as blockers, side effects of it would be, of course, pain relief, and also when you use opiates, you definitely will have, I guess, a sense of addiction. That's what we're worried about, other than the pain relief that we get. But the worry there is the overdosage of these medicines, I mean, causing respiratory depression and also altered level of consciousness. But this medicine, actually, when given with the overdose of opiates, it actually uh, reverses this effect and also reverses the addiction to opiates. And sometimes it also treats alcohol abuse. It can also help people drink less when they're on alcohol and stop drinking altogether. Let me give you a common case here so everybody can have a good picture of this. So when people take too much morphine or opiates, they can have the possibility of overdosing on it. And the most common one that you'll see is respiratory depression. So when somebody's having a hard time breathing or just so sleepy and the breathing's not there, oxygen's going down, you get an injection of this naltrexone and you inject it and they come alive, breathing normally again. So the market dose or this injection is dosed as 50 milligrams. Actually, it has been now the low dose naltrexone comes into the picture that 10 milligrams and lower of this medicine actually can be used in relation to many inflammatory conditions and even autoimmune conditions. Thus, the name is now being used low dose naltrexone for it.
Okay, so I take it that under 10 milligrams would be a low dose of
Mhm.
this medication.
Right, that is correct.
Okay, and what conditions would you use this for?
Well, first let me give you a background of low dose naltrexone and how they found it out. The dose usually is, of course, as I mentioned, less than 10 milligrams, and it was discovered by Dr. Bernard Bihari. So he's working with HIV patients, and again, all these HIV patients has low immune systems. And actually, this medicine has been used since 1985, and this AIDS study was the startup of where it all came from. And when we talk about low dose naltrexone, we're talking about endorphins. Endorphins are what we call feel good hormones, makes us happy, make us feel good inside. And endorphins are not only doing that, but they also regulate the immune system for the reason that when you get endorphin levels of these HIV/AIDS patients, the endorphins are very low. And that's why naltrexone actually was used to increase the production of these so-called endorphins to actually see that, wow, the immune system responded well on these HIV patients in the form of what? In the form of them being seen to be having lower infections, lower inflammation, and the medicines that they're taking started to take more effect and become more effective. And the trial with the HIV patients lasted for 3 months for you to see effects. And due to this finding, the common use now of, as I mentioned to you in the convention, they're using it in almost anything, from the kitchen sink to the garage door, autoimmune disease, any inflammatory disease. And this is evolving now in our world, as we all know, as we get exposed to all these toxins, all of these environmental exposures, we're adding more problems and pathologies into our bodies.
Wow. Okay. So, is there any other conditions that you may be able to use this low dose for?
Right. So yeah, thank you for asking that. That also is one of the bigger benefits of this medicine. It can be used in almost anything. So let me name a few. So when I name a few, there's a long list of stuff. But almost a vast majority of autoimmune conditions and inflammatory conditions can be applied to it. But let me give you specific examples in my practice on where I use it. One, Hashimoto's disease or thyroiditis. This is when your own immune system eats up your thyroid like Pac-Man and turns into a state where you have low hormone production of your thyroid gland. And this is common in women. So that's good to tame that immune system down. Another one would be weight loss for the athletes, for the ones who want to lose weight. You have to remember your fat cells are what we call inflammatory cells as well. They store all the toxins, and it makes it harder for you to use all your energy up because you need to get into ketosis. So that inflammation that is brought by your fat cells will be lowered down by low-dose naltrexone, thus easier way to lose weight. Another one that I see is cancer, because I work also in the cancer center, and it modulates cancer cell activity, meaning, again, cancer is an autoimmune condition, and this actually helps your immune system recognize cancer cells to get eliminated again. Another one is chronic pain. So chronic pain, of course, when you have pain, you have damage and inflammation in the organs, and this gets dampened down by low-dose naltrexone. And another common one is the GI or gastrointestinal pathologies such as Crohn's, ulcerative colitis. And we all know once you have these diagnoses, you're not having a good day, maybe in the toilet or just being in the outside doing your daily thing, because you're probably having diarrhea, massive constipation, and low-dose naltrexone helps this a lot. And other ones, Gulf War syndrome, HIV, which is the original use of LDN, where the case study had, and even skin issues like acne, psoriasis, mood disorders such as PTSD, and anxiety, depression, multiple sclerosis, allergies that we have, autism, that's another good one, lupus, rheumatoid arthritis, even diabetes. Oh, look at this, even fertility. That's pretty new, just to help women get pregnant who's having a hard time, fibromyalgia. But remember, it's adjunctive, meaning it works well with a suggestive therapy already. Let me give you an example. HIV medicines are actually more potent with low-dose naltrexone. Chemotherapy is more potent with low-dose naltrexone. It's usually not standing alone. It's actually a good supporting cast to help the main star. But there are still evidences that it can work on its own, but there's still a few studies that's out there. But that's why I use it in my practice along with other therapies as well.
Okay, is there any problems with it, negatives, any negative side effects with this medication?
Right. Well, very rare though. The thing here is there are side effects. A good one for you would be insomnia, which is the most common because you want to take naltrexone at nighttime because that's where the highest capacity of endorphin production happens. And usually it happens during the first days or if you're getting too much of a high dose from the get-go. But usually it goes away. Another one is vivid dreams. So you always, people, my patients call this getting a trip, meaning they have so much dreams, so much vivid, like they're watching their own film, they're starring their own in their own movie. Uh, Another, well, it could be a bad side effect, but this also is one of the reasons why patients like it. They get better, deeper, restorative sleep. But
Hmm.
make sure you're not saying names of other people when you're sleeping with your partner. Sometimes you get in trouble with that. And they're not
Sometimes.
well, rare. You don't want to sleep in the couch. Well, rare ones: fatigue, loss of appetite, nausea, hair thinning, mood swings. Very rare though. But that's why you need to have a professional with you. There are contraindications for it. Somebody who has major liver problems like cirrhosis, liver failure, cancer of the liver, because the liver is the one metabolizing naltrexone. Ongoing alcohol or opiate intake or pain medication intake. Because once you take this, for example, for your pain pill, it's going to lower the effect of your pain pill, thus more pain for the patient, thinking that, man, my pain medication is not working anymore. But it's because you've used a negator or a blocker. That's why it's a bad experience. And also, it can be used to lower or taper patients off who are addicted to opiates. But this is the whole nother topic, which is called very low dose or ultra low dose naltrexone, which can be very complicated to do. But this is not part of this video.
Wow. Okay. So, how do you administer it? I mean, how do patients receive this?
Right. So Steve, it's a prescription medicine still because it's naltrexone and it's usually compound. It's not a supplement that you can buy over the counter in Amazon. I hope not. Something because it's very dangerous if given in the wrong hands. Very affordable once you are qualified to get this. And the dosing regimen is started in small doses first, then you go higher and higher. So start low and go slow because of the side effects. And before in our clinic, we check liver enzymes and other labs. And also we consider the conditions, the pathologies that the patient has, and also the other medications that they are on that might have interaction with naltrexone. And this is the reason why it's supervised by your doctor and not by Amazon or anything over the counter that you buy in a food, health food store. And I always want to remind everybody it's supportive as of now. You have to have a main therapy for your pathology, and this is a good wingman for it. Not only are we using it to treat by itself, but it's going to be helping other therapies to be more potent and different dosing schedules for different conditions. RA, a thyroid problem, weight loss has different dosing depending on the case. And different forms, liquids, sublingual, capsules, tablets, topical, lotions on skin. And again, the protocol in our practice is not only low-dose naltrexone. As I mentioned to you, it works hand in hand with so many things, but here are the main ones. Fix the gut first. So gluten-free, dairy-free, lower carbs. And also we use a natural immunomodulator called plant sterolins. And this is actually a sterol group found in plants. And it's the highest amount in foods like vegetable oil, nuts, and seeds, which actually has proven to control the and autoimmune antibody production of the body to make it calm down. And also the cherry on top and the icing on the cake with this management on almost any autoimmune condition or inflammatory condition is low-dose naltrexone, which controls the inflammatory enzymes called cytokines and also increases what we call the feel-good hormones, endorphins.
Wow. Okay. So that's, we thank you, doctor. That's a new treatment that you can find out more about at Biointegrative Health Center. You can also find out about all the other, what I think are really cool treatments that they do at Biointegrative Health Center for the different things that they treat and what the treatments are. So Biointegrative Health Center is in Reno, Nevada. You can check them out online and see what they do. Thank you for being here, Doctor.
Thank you, Steve, for having me. As we all know, that knowledge is power, and thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.